Have you ever thought, what was going through their head? Why would they do that? Or even, why do they keep doing this? At some point, most people have probably questioned someone's behaviors and have had difficulty understanding them, maybe even their own. Trying to understand people's emotions and behaviors can help create empathy and help us take a more passionate approach to what people may be going through. This section will discuss the connections between emotions and behaviors, cognitive behavioral therapy, which we will refer to as CBT, and some common misunderstandings we may come across. What exactly is an emotion? The first thought may be a feeling, which is not wrong. Emotions may be easy to understand when feeling them, but how do we define them? In short, an emotion involves thoughts, perceptions, like subjective feelings, expressions, and even physiological aspects, like our heart rate. These are normally short-lasting, fleeting, and are usually related to something concrete, like an event. These are not to be confused with a mood, which are longer-lasting, less intense, and may be attributed to something more ambiguous. Some studies have stated that we have experienced emotions within a list of common basic emotions, such as fear, anger, disgust, and surprise. Others state a perspective where the emotions are not clear but lay on a spectrum. Either way you choose to see emotions, the emotions wheel can be a useful tool to expand our vocabulary and be more specific about how we feel. Now that we understand emotions, what are behaviors and how are they connected? First of all, we can define behavior as any observable response or activity in a person. Some connections between how we feel, which are our emotions, and how we act, which are our behaviors, may be obvious. When we're angry, we may yell. When we're sad, we may cry. And when we're happy, we may smile. These are some of the basic human emotions that are universal and have been studied for decades. However, what are sometimes misunderstood or overlooked are the more intricate feelings that humans often experience. For example, what happens when we feel shame? As with basic human emotions, behaviors can be complex and can be determined by multiple interacting causes, such as how we are feeling, biological factors, or even be somewhat to do with heritability. What may be even more confusing is how our emotions interact with our behaviors. This is where our cognitions come into play, or how we acquire, store, and process information. The prevailing ideas regarding behavior are that they are influenced by our thoughts and emotions, and vice versa. This is the basis of CBT. In short, the principle is that our behaviors and emotions are influenced not by just events, but how we perceive them, our thoughts. For example, people who experience depression are more likely to have negative perceptions of events that happen. We can think of this as a combination of our core beliefs, assumptions, and automatic negative thoughts. To understand how these thoughts, behaviors, and emotions interact, it may be easier to picture a triangle. It is important to note that these arrows can go either way. So not only do our feelings affect our actions, they also affect our thoughts. Our actions can affect both our feelings and thoughts. Likewise, our thoughts affect both our actions and feelings. By using this model, it is easy to see the interplay between these three parts of ourselves and why we behave or feel the way we do. Another important aspect that this model shows us is how to interrupt negative emotions, thoughts, or actions. It is difficult, perhaps impossible, to change the way we feel. For example, if we're feeling sad or depressed, we cannot just decide to be happy. However, we can change what we are doing, our behavior or action, or what we are thinking. Perhaps going for a walk in nature will help us think of more positive thoughts and make us feel better. Conceivably, playing basketball or another activity we enjoy will change the way we feel. Maybe thinking of your favorite place, person, or time you were successful will change that negative emotion to positive, or turn that frown upside down. Now that we have a basic understanding of behaviors and emotions, we can relate this to substance use and mental health. As this section began, we may often ask why someone does something or why they keep doing the same behaviors. If we combine the knowledge we have from substance use and mental health disorder unit with this concept of thoughts, emotions, and behaviors, we have a pretty good understanding of why someone we care about does the things they do. However, it's important to understand that while behaviors are understandable, they do not need to be accepted. Often, when people are feeling bad about themselves, have negative thoughts, or are behaving negatively, they act out. This could lead to negative behaviors landing on others. Again, these negative behaviors and projections do not need to be accepted, as they can lead to an internal cycle of being angry, frightened, or depressed. We cannot help anyone if we can't help ourselves. Sometimes, stepping away from the situation and taking care of our own emotions and thoughts are the best way to help someone else. Whatever these thoughts, emotions, or behaviors you or your loved ones are experiencing may be, it is important to know that they are real and valid. Often, these behaviors are symptoms of an underlying emotion that we do not recognize. Let's take that example of the person who is displaying anger and look to blame someone else. What might that underlying emotion be? Are they just angry or a jerk? Consider how shame may manifest itself in someone. Using the CBT triangle, we may feel ashamed of our substance use and inability to stop, or how we treat others, which makes us think that we have no control and cannot get better. This is hard to admit, and so the behavior may be lashing out and blaming others to avoid that feeling of shame. This example shows how a downward spiral can be created. However, as mentioned above, by intercepting and adding a positive action or thought, we may be able to intercept the spiral. Clients who come to the center are often experiencing many of the difficult emotions and intrusive thoughts that come along with substance use and mental health disorders, and are exhibiting a wide array of negative behaviors. As mentioned in previous sections, many of the modalities and approaches used at the center are cognitive behavioral in nature. The most obvious is the use of CBT. CBT has been shown to be effective in the treatment of major depressive disorder, adult and adolescent bipolar disorder, generalized anxiety disorder, panic disorder, social phobia, post-traumatic stress disorder, as well as childhood depressive and anxiety disorders. CBT has been effective in the treatment of substance use disorders. Some of the groups that utilize CBT are social skills training and seeking safety, along with various CBT-based interactions happening during live-in treatment. Dialectical behavioral therapy, known as DBT, is a derivative of CBT, created with a focus on emotional and social aspects to help cope with more extreme emotions and behaviors. These groups help our clients understand their experiences are real and to accept things how they are, in themselves, regardless of difficulties they have endured. Partnering these cognitive behavioral sessions alongside the ACRA framework are the basis for the center's programming, which focuses on creating healthy, resilient youth and families who have hope and life skills for creating a positive future.